Here at White County Medical Center, we want to make sure you're as safe as possible. Anytime you're using a syringe or needle, giving an injection or medication, always look for the safety feature. Today, I'm going to show you a few that you will use most often. Anytime you're given insulin, you would, of course, use an insulin syringe, draw up your medication, and give your injection. Once you're through giving your injection, always be sure to point the needle away from the patient and using your thumb, lock the safety shield over the needle. You could also do this on the edge of a table, always ensuring that you hear the click and the needle is completely covered. This syringe would then still need to go into the sharps container. Our TB syringes work the same if you're giving a TB injection. Again, when you're through with your injection, be sure you use the slide glide and your thumb and slide the cover up completely over the needle. If you're given IM, intramuscular injection, you would get your syringe and your needle. These needles also have a slide glide safety feature. So after you've given your injection, again, you would use your thumb and slide up the safety feature. Always be sure to use whatever safety feature you have available to you to prevent needle sticks. When drawing up medications for IV infusion, we have a couple of vial access devices that you can use. We have what's called the vial access cannula that's blue, already connected to the syringe. You could use this to draw up Lasix, Pepcid, any medication out of its original container that you are then going to give intravenously. This is what we call a blue tip. When you puncture your vial, you of course would draw up your medication, and when you pull your syringe out of the vial, it leaves the blue tip inside the vial. This is fine because most of our vials are a one-time use. If for some reason you are using a medication from a vial that's not a one-time use, then you would not want to use the blue tip. Once you've drawn up your medication, when you go into your patient's room to give this intravenously, you will twist off the whole part, the whole cap. Then our IV tubing are what we call syringe to port. So you would be sure that you scrub the hub, connect the syringe to the port, and then give your medication. We also have what we call the twin pack. Everyone likes the twin pack. The twin pack is quite a bit sharper, but it is quite a bit more expensive. Anytime that you can use a plastic access device or the blue tip vial access device, do so. There are some times, however, when you might need a sharper vial access device. Then you could use what's called the twin pack. The twin pack has a blunt tip that's still quite sharp. It's good for drawing up Solu-Medrol or other medications that are difficult to puncture. Again, just like the blue tip vial access, after you draw up your medication, once you go into the patient's room, you would twist the whole needle portion off and then give your medication syringe to port. That is a good safety feature that we have with our IV tubing, is that it is syringe to port. You would never want to puncture one of the ports with any type of needle, be it blunt or sharp, in your IV tubing. Just remember, anytime you're giving a medication or injection, to use whatever safety device is that is available to you. Now, we're going to talk a minute about IV therapy. If you are starting an IV in our facility, you would do that just like you were taught at school. You will, however, be using our supplies, so I want to go over some of our supplies that you'll be using with you. When starting an IV, you'll first need to be sure that you get our IV start kit off the clean supply cart. You'll then need to get an angiocath off the clean supply cart. The extension tubing off the clean supply cart, they're all there together. And a flush, this will probably be in your med room somewhere around the Pyxis. These are the saline flushes. We don't charge for those, so you can just grab one and go. So this is what you'll need if you're starting an IV. Now, the reason I like to go over IV therapy is our angiocaths are a little bit different if you've used some other ones at other facilities. Ours are called BD Inside Auto Guard. It is a little bit different if you've not used this before. So I'm just going to go over the technique of our angiocath. And then however you're taught at school to start your IV will be fine with how you do that here for us. Okay, so as far as the company recommends, they recommend that once you take the cap off, that you rotate the hub of your angiocath, this Cathlon, 360 degrees till you can feel it click back in. This catheter, what makes it unique, is the Cathlon is made, or the catheter is made of a Vylon material that's really flexible. It's good for your patient because it's more comfortable, but it does make it a little bit harder to thread because it's not as stiff. Once it gets in the patient's vein and that warm blood hits that warm blood, it becomes even more flexible. So it's best to thread your catheter as quickly as possible. Also, the needle on these are really sharp. So what happens if you're not careful is you'll go right through the patient's vein, and so you'll blow their vein without even knowing you've done so. So anytime you're starting an IV using this angiocath, you want to be sure you rotate the hub 360 degrees. The nice thing about this catheter is as long as your white button's up, your bevel's up, so you don't have to look and make sure your bevel's up. Just make sure your white button's up. When you get ready to start your IV, the company recommends that you go at a 30-degree angle. So if you were taught a little bit higher degree angle in school, when you're using this angiocath, you need to go about a 30-degree angle when you're inserting into the vein. They also say to go slow. So go low and slow. And you're going to be watching for your blood return. This has good little grips that you can grip your angiocath with, and then I usually use my other fingers to stabilize the patient. So about a 30-degree angle, low and slow, watching for your blood return. Once you see blood return coming back up the catheter, you want to drop your angle a little bit further and advance about another 1/8 of an inch. Then, of course, you would pop your tourniquet. This has a little notch on top if you're a one-handed threader. You would thread your Cathlon in, leaving your needle still, and then when you're ready, you would hit your white button to retract the needle so that you can set that down. Now, of course, I would be holding right here so we're not bleeding back everywhere. One thing that we do also here at White County is we attach the extension tubing to the angiocath. So you would want to have this ready and flushed, and then this would be attached to the angiocath. Okay, now again, I did not teach you technique, We were just showing you the use of the AngioCath. So however your school teaches you in other relations to this, then you can follow that protocol. We don't care how you tape this. We do like at White County though to use the Tegaderm or the transparent dressing on top. Okay, so if you started an IV, you were successful, yay. You got it flushed, you got a good blood return, you got your Tegaderm on top. You always want to be sure that you date it for the date you inserted the IV. You can use the date on the Tegaderm, or there's another date also here in the package. So either one, you've got two options. We just always want to be sure that we put a date on the day that we started the IV. Also, anytime you're starting an IV, if you'll notice in your IV start kit, we have what's called ChloraScrub. You always want to be sure that you use the ChloraScrub or the ChloraPrep prior to starting any IV. If you like alcohol, you can use alcohol to clean the patient's skin or find your IV, but before you stick, you want to be sure that you use the ChloraScrub. You would open this up. It's going to look like a little stick. It should be fairly saturated. And it's a back and forth scrubbing motion for at least 30 seconds. It just feels like forever. And then you want to be sure you let that dry. Okay, so you could let that dry while you're getting your other stuff together. Okay, the ChloraScrub or the ChloraPrep is what keeps killing the germs. At White County Medical Center, we use Hospira Plum A+ pumps. I'm going to show you now a little bit about our pump and our IV tubing. Initially, you would have to prime your tubing, of course, with whatever fluid the physician ordered. So you get your IV fluid and you get your IV tubing. Primary plum set is how it'll be labeled. Okay? So we're going to open our tubing. It comes out of the package with the clamp off, and then we're going to spike our bag of fluid. Well, you've probably learned this at school. The important thing that I want to show you is how you prime this tubing specifically. So you'll hang your bag up. And I'll tell you a few things about our tubing first. This little green clamp, I don't know if you can see, but it looks like a person. If you'll put it in the head position and slide it up, it's not clamping your tubing off and it'll stay out of your way. Then we have our cassette. These cassettes are fairly fragile, so you want to be careful with them. It's also important how you prime your cassette. Now on the back of your cassette, this white round knob is your clamp. That acts as your clamp. So if that is all the way out, your tubing is all the way open, and if it's all the way in, it's closed. Now it has ridges, so when you actually are here working and you see one, you might think it twists. It doesn't twist. Those ridges are how you regulate the flow. So all the way out would be wide open, and all the way closed would be completely closed. Okay, now when you get ready to prime your tubing, of course, take this off, what you're going to want to do is invert your cassette. So some people remember that blue to shoe, however you want to remember that, but you're going to want to invert your cassette. All right, so we've spiked our bag of fluid. We get a little bit in our drip chamber, about 1/4 of the way full, and then we're ready to prime. All right, so we're going to invert. We're going to have to open our clamp. So the clamp on the back, I'm going to completely open. And what we're going to do is let this odd-shaped chamber completely fill with fluid. When one drop hits that dome, then we're going to flip it and let it finish priming like any other tubing. All right, so we're going to invert the cassette. We're going to open the clamp. Gonna let our fluid flow, completely fill. One drop hit the dome. I flipped it, went a little quicker, and now I'm gonna let that finish priming. Now when our tubing is completely primed, then I will clamp that back off by pushing that button completely in. Now our tubing's ready to go in the pump. It's important that you prime the cassette properly because sometimes you can get air in the cassette and your pump will beep air, and it can be very irritating. So if you'll take a few seconds and prime your tubing correctly on the front end, it will save you time on the back end. Now, a little bit about our pumps. If you're looking at the back of the pump, there's a few features on the back that you might want to know. The top one is our volume knob, so you can adjust the volume up or down. There is a black toggle switch, which you may not be able to see, but when you're here at the facility, you can kind of look at the pumps a little bit. If you need to lock out your pump for any reason, the family members keep hitting the pumps or the patient the keys and changing stuff, then you can actually flip that toggle switch up and it locks out your panel on the front. If you come into the room and you're trying to adjust your settings on the IV pump and it's not letting you, it says lockout, then you need to come here and flip your toggle switch down and that will unlock it. This pump also has a feature down here where it will connect into the patient's call light. If we do have a patient that if their pump alarms, maybe they would not be able to turn on their call light. Okay, if you'll notice this purple piece, this pump is like a small computer. It is wireless, so that's where the software is. It has what we call safety software attached to it, which helps provide IV therapy, especially with medication in it, at a safe rate to the patient. All right, so we're going to turn our IV pump on. And we're going to open the door using the handle. If your pump's not in use, you always want to make sure your door is closed, the handle is down, because these can break easy if they're hit. When you put in the cassette, it does go in at an angle. You can hold it by the fin, and then once it hits the right slot, it will slide right in. If it doesn't, don't force it. Once you have your cassette in, you will close it. It does a little self-test, and then the first thing that will come up is CCA selection. That stands for Clinical Care Area. We are looking at reports monthly regarding the IV infusion pumps. One of the first things that we look at or that we want to make sure is done correctly is the correct CCA to be selected. What that means is basically where you're working. Are you working on 3 North? Then you want to be sure that you plug in 3 North for your CCA. All right, but to do that, you just move your arrows up and down till you find 3 North. Once you do, you hit enter. I've got 3 North up on my pump now. Anything that goes through the cassette and through the pump is channel A. So I'm going to hit channel A. And the second most important thing that I can do is use the drug list. This is a drug library that we've put into the IV infusion pump that is specific to White County and your specific CCA. So that's why it's very important that you select the correct CCA. All right, so I'm going to go drug list, and you may be thinking you only have normal saline hanging. You still go through the drug list, whether it's normal saline, D5W, or a Lasix strip. So whatever medication I have hanging, I use the drug list. You can use your up and down arrows, or you can page up or page down to find the appropriate IV fluid. Now, if you do have normal saline or D5W with no additives, then we have got one generic label in here that says IV fluid without potassium. So So I would look for IV fluid without potassium. If I had D5W with 20 K hanging, then I would look for IV fluid with potassium. If I had a Lasix strip or something else hanging, then obviously I would look for that. Okay, so I'm going to select IV fluid without potassium. So I find it, it's highlighted with the cursor, and I hit enter. Then I've got option of standard program, loading dose, or multi-step. You will probably only ever use standing program here at White County. Our loading dose and multi-step is if we have to deliver a different amount of fluid at a different rate out of the same bag. The pump will allow you to do that without having to go back in the room and change the rate after an hour or two. I'm not going to go through that with you since you will probably never use that. You will always select standard program. So to do that, I hit choose. The next thing comes up is my rate. The rate is how fast you're, of course, going to run your IV fluid, and that's going to be dependent upon your physician orders. So if he ordered normal saline at 100, I'm going to put in my rate as 100. My volume to be infused, I just arrow down to that next section. If I hung a liter bag, I would typically put in 975. That gives me a little time when the pump alarm's complete for me to get another bag of IV fluid. So I put in 975, then I'm hit start. When you hit start, another part of the safety software is that it's going to ask you to confirm the program. So again, that's just another safety check. It says normal saline at 100 out of a liter bag. Are you sure? If that's all correct, you hit yes to confirm your program, and now it's pumping. The green light is flashing. When that's flashing, that means your pump is running. And it's flashing over channel A, so you know channel A is infusing. So if you walk into a room, the pump's already set up and running, what should you look for? Number one, make sure the correct CCA is on there, so the correct area. Make sure the correct IV fluid is on the pump. And then make sure, of course, whatever the physician ordered is what is hanging and at the correct rate. So that's basically how you would start or monitor a primary IV infusion. If you need to hang a piggyback or a secondary infusion or an antibiotic, you would, of course, get your medication, get your secondary tubing, spike your antibiotic, put a little in your drip chamber. We're going to hang that. You would prime your tubing, scrub the hub. Always clean your hubs and ports really well with alcohol. CDC recommends at least 15 seconds. And then we're going to attach our secondary or piggyback to the blue hub. Okay. Then, of course, we'll unclamp. And now, anything that goes through the blue port is going to be channel B. So I'm going to select channel B, and it automatically comes up piggyback mode. What piggyback mode means is anytime my piggyback is infusing, my primary stops. If for some reason I want both of these to infuse at the same time, then I need to select the button down here that says change mode. So I'm going to select change mode, and then it says concurrent. That means these two will run concurrently. Now, most every time you will just use the piggyback mode, but if for some reason you needed to do that, I wanted to be sure you were aware of that feature. Okay, so we've got piggyback mode. The next most important thing we're going to do is go through the drug list. Correct. So through the drug list, and we're going to find our antibiotic or whatever we've got hanging here. Okay? So again, the antibiotics typically in most of the CCAs, the clinical care areas, are at the bottom of the list, so it's probably going to be best for you to page down, and you'll get through some of those quicker. So I found Zosyn, so I'm going to pick that one, hit enter, and again this comes up standard program, loading dose, multi-step. We're going to stick with standard program, select that one by hitting choose, and now you've got piggyback mode, you've got your antibiotic, and you've got your correct CCA, and now we're just going to arrow down to put in our rate. So again, that would be whatever the physician ordered or whatever piggyback you've got hanging would be your rate, and then you'll scroll down, hit your volume to be infused, and then hit start. Once again, when you hit start, it will ask you as part of the safety software to confirm your program. So if all of this is programmed correctly, I'm going to hit yes. Now, if you can see, you will have your piggyback pumping. So channel B, the green light is flashing, and your primary channel A is delayed. So if you walk in the room at any given time and somebody has both hanging, you should be able to look at the pump and easily tell if your primary's running or if your piggyback's running, or if they're running concurrently. Now, if your IV pump alarms, there's a couple of things that could be wrong. Number one, if it alarms and says KVO, then your fluid is almost empty and you need a new bag, or you need to reprogram your volume to be infused. If you walk in the room and it's beeping proximal occlusion, that means the tubing above the cassette is kinked off. That sometimes happens. These tubings will bend down. So you always want to be sure you have your IV pole high above the pump, and this green thing kind of out of your way kind of helps guard your tubing. If it beeps distal occlusion, then there's occlusion below the cassette. The patient's bent their arm or it's kinked up under them. You will have to go in the room and correct. It will alarm like that for distal occlusion. You'll go in the room, hit silence first. That eases everyone's anxiety, and then fix the occlusion and hit start. Okay. If the pump alarms air, remember at the beginning when we talked about priming the tubing, I said it was very important that you primed it correctly because you can get air in this cassette. If there's air above the cassette from your piggyback or your tubing somehow, this pump will alarm air. If the pump alarms air, you will get a back prime button where you can back prime the air out of the cassette up into your piggyback tubing. So it'll take fluid from your main IV fluid and prime it backwards up into your piggyback. The whole time that you want it to be priming, you will have to hold back prime. So I'm holding back prime. I'm back priming from my primary, as you can see, up into my secondary. So that will help you get the air out of your cassette. And when you feel like all your air is out, you've back primed it all the way up, then you just release the button and hit start. If for some reason you don't have a secondary or a piggyback connected to your blue port and your pump is beeping air, then what you could do is get a 10 cc syringe. Again, scrub the hub really well. Put your syringe on to the blue port. Loosen that plunger just a little, and then you can back prime air out of your cassette into the syringe. So you can back prime either way, into your piggyback or into a 10 cc syringe. You would just never want to leave a syringe connected without a plunger attached. Our IV tubings and peripheral IVs here at White County are good for 96 hours or 4 days. You always want to be sure your IV is labeled the date you started it, and your tubing is labeled for the date it was hung. We have orange stickers, orange labels for our IV tubing as well. If you're looking for IV opportunities, then look around at the patients in your area. Do you see IVs that are out of date or close to being out of date? If so, then you could try to restart that. If that patient is going to keep the IV longer than 96 hours, then we would restart it. You never would DC an IV before you had another good one infusing. Thank you for coming to White County Medical Center. We hope this video has helped you with your transition into your clinical rotation.